Hello everybody, my name is Dr. Pratima Sharma. This video is regarding the approach to deal with the case of subacute thyroiditis in NAC OSCE exam. The content of this video is only for the educational purpose. Let's start with what is thyroiditis. It is a general term for the inflammation of thyroid gland. There are various types of thyroiditis, and in this video, we are approaching a case of subacute thyroiditis, which is also known as de Quervain's thyroiditis. Subacute thyroiditis is an immune reaction of the thyroid gland that often follows an upper respiratory infection. It occurs mostly as a result of viral infection of ear, sinus, or throat. Many viruses such as mumps, influenza, adenovirus can cause this. Peak incidence occurs generally at the age of 30 to 50 years, and women are affected 3 times more frequently than men. Now let's talk about the clinical symptoms. The most common symptom is the pain in the neck, and it is caused by swollen and inflamed thyroid gland. This pain can also radiate to jaw and also to the ears. Other symptoms such as difficulty swallowing, hoarseness of voice, and fever can also occur. Likewise, the inflamed thyroid gland can cause hyperthyroid as well as hypothyroid states depending upon the phase of the illness, so patients can show the symptoms of hyperthyroidism such as diarrhea, hair loss, heat intolerance, palpitations. Likewise, they can also show the symptoms of hypothyroidism such as cold intolerance, constipation, weight gain, and fatigue. Let's talk about the example of a case scenario of subacute thyroiditis that can be present in the exam of NAC OSCE. Example is a 32 years old female presents with the complaint of neck pain and swelling for 2 weeks. In the next 8 minutes, take a focused history and perform a physical examination. You will have 2 minutes to read this clinical scenario and write the differential diagnosis before you enter the room. Once you enter the room, sanitize your hands and start by introducing yourself. Ask the patient how she would like to be addressed, then approach the history taking. You can approach it via the mnemonic OCT PQRST AAA, where O stands for onset, whether it is sudden or gradual, then comes the course and the duration. Then PQRST is regarding the pain, the position of the pain, quality of the pain, any radiation, severity, and the timing. You also need to ask about aggravating and elevating factors. Then comes the important part of the history, which is the associated factors. In this case, you need to ask regarding any recent flu-like symptoms. Does the patient feel any tiredness or fatigue? Whether there is any heat or cold intolerance? If there is any sweating or hand shaking, does the patient feel heart racing? Is there any diarrhea or constipation? If there is any change in appetite, change in voice, change in vision, any weight changes, you also need to ask regarding the last menstrual period. Any change in the menstrual cycle should be asked. Now you can proceed towards the past history, where you can ask about any kind of diseases in the past such as diabetes or hypertension, whether they are on any kind of medication, have they been diagnosed with any cancers in the past, are they allergic to any food or medications, have they been through any kind of surgeries in the past, any history of thyroid problems or any kind of radiation exposure. Then you can proceed to family and social history, where you can inquire about smoking history, alcohol history, and also use of recreational drugs. You can ask about the family history of thyroid disease or any kind of cancers in the family. Then you can conclude your history by asking about what does the patient do for a living and whom do they live with. Then you can proceed towards the physical examination. Due to the safety protocols, there is no need to perform physical examinations directly on the patients. However, you need to verbalize all the physical examinations that you would like to perform in the patients. After each portion, give the examiner enough time to say the findings. In this case, you would start the physical examinations with vitals. Comment if there is any fever, tachycardia, or hypertension. Then comment on the general condition of the patient. Now you can proceed towards the hand inspection, where you will be inspecting for any sweating on the palms, any nail changes, and palmar erythema. You can check the outstretched hands for any fine tremors. You can ask the patient to shrug the shoulders to check for the proximal muscle weakness. Then comes the face, where you will inspect the face for any anemia, jaundice, eye redness, exophthalmos, lid lag, and lid retraction. Then proceed towards the focused examination of the neck, where you will inspect the neck for any obvious swelling, scar, or erythema. Then ask the patient to take a sip of water to look for any thyroid enlargement. Now proceed towards the palpation, where you'll palpate for any mass or nodules. If there is any mass present, then check for size, shape, border, number of nodules or mass, consistency, and mobility. Check for any temperature or tenderness. Then assess for the thyroid movements by offering the patient a sip of water. Check for cervical and submandibular lymph node if there is any lymphadenopathy present. Now proceed towards the percussion. You need to percuss the upper end of the sternum, looking for any retrosternal extension of the thyroid. Then comes the auscultation, where you need to auscultate both lobes of the thyroid for any buoy. Then check the knee reflex for any hypo or hyperreflexia. Check for pretibial mixed edema. This will conclude your physical examination. After 8 minutes of history taking and physical examinations, now the examiner will ask you regarding the case. You'll have 3 minutes to answer all the questions. In this case, you might be asked regarding the investigations and the treatment. The most important investigation in subacute thyroiditis is TSH, T4, and T3 level. Further evaluation can be done by radioactive iodine uptake, thyroglobulin level, ESR, CRP, and thyroid ultrasound. Now let's talk about the treatment. The main goal of the treatment is pain relief and symptom control. Mild to moderate pain can be treated with NSAIDs such as naproxen and ibuprofen. For severe neck pain, oral corticosteroids can be started. Mild and transient symptoms of hyperthyroidism do not require any treatment. However, palpitation, anxiety, and tremors need to be treated with beta blockers such as propranolol or atenolol. Subacute thyroiditis usually resolves and patients return to a normal euthyroid state in 3 or 4 months. Until then, regular follow-up is needed.